So someone realized that doctors were performing medical procedures that were unnecessary and billing the federal government. Well, the federal government the Congress has put into place some laws that say if someone learns that the federal government is being cheated, if you tell us about it and we're successful in recovering money from the bad guys, we'll give you some of the money for blowing the whistle.
Okay.
And so what you had were people on the inside, either people that worked for the doctors, worked around the doctors, or ultimately saw patients of those doctors later on. And bells and whistles started going off around the country in various pockets, and they started reporting these things to the various agencies that were responsible for trying to recover money on behalf of the federal government. People started blowing the whistle, saying, we know this doctor's doing this, we know this hospital is culpable, knows about it, is engaging in the activity, and they're reaping the benefits. And so the federal government started cracking down and have fined some institutions as much as $100 million for payments that they billed the federal government for that they weren't entitled to. That's called Medicare fraud.
Right.
And they also uncovered through that process what are called Stark's Law violations, which are doctors and hospitals engaging in self-referrals or quid pro quo relationships. Those are illegal. And they found that hospitals and physicians were engaging in them, saying they would either have, in some cases, written contracts, but mainly understood relationships where if you would bring in so many cardiac catheterizations, we will pay you X dollars. Those relationships are illegal. And so hospitals have been forced to refund the government federal money under those kinds of cases. So that's one type of case where the government is trying to recover money.
Yeah.